Also, my topic for this project is nonlinear phonological intervention. Basically, within the next couple of slides, going to go over the topic, some key terms, as well as how to integrate this into therapy plan and how it benefits the child or patient at hand. So, nonlinear phonological intervention as a whole looks at both the strengths and the weaknesses of the child. With that being said, it also recognizes or acknowledges that the phonological system as a whole is very broad, but also more complex than just speech sounds in general. This allows the clinician to break phrases down for the child to the specific manner, place, and laryngeal features, allowing the clinician to see what exactly or where exactly the issue may lie and kind of how to fix a couple of things at once. I think this both has its positives and negatives, and we will definitely cover that later on in this presentation. So as previously mentioned, this theory or this sort of intervention breaks the phrases down into different sections or chunks, whatever you want to call them. But it's also separated into two different tiers. So there's the prosodic tier and the segmental tier. So the prosodic tier is basically all elements beyond this segment. Sorry. And the couple of terminology or terms to keep in mind when reading about this sort of intervention. There's the foot, which consists of one stressed syllable and any associated syllables. And then this prosodic tier is also broken down into another tier known as the onset rhyme tier, which represents the syllables of the phrases. So the onsets are the consonants left of the vowel, and the rhymes are the vowels, or also known as the nucleus, and possibly a coda. And a coda basically consists of one or more consonants to the right of the nucleus. So the rhyme is kind of in the center, and onsets are to the left, codas are to the right. And then a mora is the timing unit in syllables. So one mora is known as light, and two moras are known as heavy. So the second tier of nonlinear phonological intervention is known as the segmental tier, which is where the consonants and vowels are characterized. So the first term that kind of stood out to me was the feature geometry, which basically describes the tree root looking like system that is the nonlinear phonological intervention system. And then the associated lines, which are the link elements in the tier that are always making sure that they are expressed at one point. So you have the root node, the laryngeal node, and the place node, which are basically the three main focuses in which the phrases are really getting broken down into. So although there are specific populations that this sort of intervention can be used with or used on, it can also be used on those typically developing or through at any point in time in an individual's life, but we also see it being used with individuals with speech sound disorders, morphosyntactic production impairment, autism, cleft palate, or even Down syndrome, and I'm sure there are many, many more populations that would use this sort of intervention. I do feel like it would be more beneficial with the younger ages, but I also think if it was a slightly minor or not a serious speech sound disorder, it could be used later on in life as well. So when it comes to the nonlinear phonological intervention, there are several different approaches when it comes to this type of intervention, but the one that really stood out to me were the minimal and maximal pairs. So the minimal pairs are more suitable for the mild or moderate speech sound disorder children with 1 to 2 non-age appropriate phonological processes, or to modify accents, somebody that's coming to America that probably has a little bit of an accent left, but just wants to better their English speaking. And then the maximal pairs are suitable for children with at least 6 missing sounds from their inventory with normal oral and speech motor abilities. Um, Both pairs are concerned with contrasting differences among the phonemes to be able to organize the speech sound. So these two pairs, or this approach, really stood out to me because it does show how it could be applied to the younger ages if you look at the maximal pairs, or it can be applied to the older ages, such as the minimal pairs, like how it could be working on adults that are trying to, or even young adults that are trying to modify their accents. So to look more into it and how you could really apply this sort of intervention to therapy, the minimal pairs approach includes 3 steps, which I think when you look at this theory in a whole, it kind of can get overwhelming looking at the hierarchy and how to break everything down, and having it only down into 3 steps with the minimal pairs approach is really easier to take a hold of. So these 3 steps include familiarization, listen and pick up, and production. So familiarization is where you lay down, or the clinician would lay down 10 pictures and familiarize the child with those 10 pictures, basically state what the picture is and make sure the child is aware, like, okay, if you're showing a picture of tape, you say tape, and then the child is able to associate the word with the picture. Then the next phase of this approach is listen and pick up. So you spread out the pictures, again, obviously in a different order, and then you instruct the child to pick up blank. So as previously mentioned, if there's a picture of tape, say pick up tape, and you would keep in mind or see if the child picks up the picture of tape, and you continue to do so until there are no pictures left. And then the final step, which would be then carried out, this step is carried out over future sessions, is production. And this is where the child takes a turn being the clinician or the teacher and basically does what the last 2 steps included, spread out the pictures, and then the child is instructed to tell the clinician, okay, pick up whatever picture they want to be picked up. And it is we're basically looking to see if the child is able to produce those words. And even if there is an attempt at the word, still pick up what the child attempted at stating. So when it comes to finding articles in support of nonlinear phonological intervention, Bernhardt, Stemberger, and Cheris, they suggested that although this intervention plan is good, in the short term, it does lack long-term normalization and should be probably integrated or worked or developed in with other intervention plans, which I totally agree with. I think it is definitely going to be a good task to use and to be implemented into a therapy plan, but definitely is weak on its own. And then Bernhardt and Zhao in 2010 found or did some research on this intervention plan when it comes to English speaking and Mandarin. And it was quite interesting to read this article, given that it was looking at how the Mandarin language, the words, the way that the phrases and the words are created are quite similar to English, and gave the same type of idea that we've been talking about with bilingual students, where we may need to be able to work along with the family, language support workers, and other individuals that are strong in the native language to be able to create an intervention plan. Overall, I really liked doing the research on this project. It was interesting to see another approach to be able to break down words and work with the children, but like I mentioned, it is quite weak on its own and would need to be integrated or work along with other intervention plans.